Good afternoon. Happy to see all of us survive the coronal mass ejection impact. Was a good one. I'm going to talk briefly today about COVID-19. And not going to go political. Not even going to really draw any conclusions. Going to draw out a couple of statistics and let everybody draw their own conclusions with a couple of caveats. Today, let's compare two countries for the past week, ending today, the 31st of October. India and the United States. This comparison has then been done by others. I'm going to do it short and sweet. India has a population of 1.4 billion souls. The United States population is 331 million. The United States has 23.6% of the people of India, less than a quarter. The vaccination rate in India is 23.4%. The vaccination rate in the United States is 58%. So percentage-wise, we're twice as well vaccinated as they are. This week, the infections in India, with 4 times the population, was just over 84,000, 84,194. The United States infections was 427,554. So over 5 times as many people infected. And 5 times on 1/4 the population is, well, something like 20% better, worse. Now, the weekly deaths in India, this week, there were 3,370 deaths in India. Their death rate from COVID stands right at 1.3%, within a tiny margin. The United States, the death rate stands at 1.6%. India, the United States. Not going to go into a lot of details on it, but these charts accurately represent the numbers I just gave you, except they don't show vaccination rates. They show infections, deaths, and recovered. Obviously, something is different. Culturally, of course, the nations are very different. India is far more densely populated. Social distancing there is more difficult. Now, what are the differences? Let's take vaccinations out of the equation. Let's say there were no vaccinations on either side, and these numbers still reflected that. Are they better at social distancing? Doesn't seem possible. Country's far more crowded. Is it possible that they're better about hand hygiene? Maybe not. Wearing masks? Well, they struggle with personal protective equipment far worse than we did. So what are we left with? Probably the single largest factor is how they treated people when they had it, or what they did prophylactically to prevent it. And we may go into that later, but what this does demonstrate is that you can't just say vaccinations are it. The vaccinations do the whole job, and there's nothing else that we need to worry about. You also can't say that you have to discount vaccinations. So that's it. You have to look at those two sets of numbers. A nation that has a far higher vaccination rate and is less densely populated and has a really, really excellent healthcare system by anybody's standards, versus a nation with far less economic might, far poorer infrastructure to handle this. I dealt with a physician from India. We discussed at length the situation there when the COVID crisis first hit India in a big way, when their rates were just going through the roof. And they had their classic curve, but they struggled with unimaginable problems compared to what we had. Having to use trucks to haul bulk tankers and then having to have helicopters deliver tankers of liquid oxygen, trying to supply the nation with oxygen concentrators because they simply didn't have the infrastructure to support the transport of liquid oxygen for the treatment of patients. And yet their recovery rate, their death rate is statistically significantly better than ours. And with far fewer vaccinations on board, they have almost eliminated the problem. So maybe we should dig into what they did different and learn a lesson from it, huh? We'll see you again soon. If you like this, like and subscribe. Thanks a lot.